Well, at the height of this pandemic, the Commonwealth Medical Team, you may remember this, went public to urge Australians to get tested. Now, the numbers in key states at the time were hovering around 5,000, and they were willing us to reach 15 to 20,000 quickly to offset that wave, which at the time sounded unachievable. But as New South Wales and then Victoria dealt with the fear of growing clusters, those numbers were actually achieved, and consistently so. But today, our past testing tallies were blown out of the water by a number no health official could have predicted. In the 24 hours to 8 p.m. last night, New South Wales residents, and in particular those in the cluster zone of the Northern Beaches, racked up more than 60,000 tests. Now, we were tipped off yesterday that all testing clinics were getting through some heavy-duty numbers, but not this many.
I nearly fell off my chair literally when Dr Chan and I and others realised that 60,000 people came forward to testing to 8 p.m. last night. That 60,000 people in one 24-hour period is beyond outstanding.
Now, this is the kind of outcome you get when two significant factors work together. A very willing public, desperate to expose and kill off the virus because they want their Christmas back. And working with that motivation is one of the world's best health systems, which, as we know, has been cranked up to a very powerful and efficient level, allowing a super-fast testing regime to operate day and night. When this biosecurity nightmare will near an end, hopefully sometime next year, we will look back on these few days as turning points in the tough fight against this very stubborn invader. And so with Sydney recording another single-digit overnight infection number, it was 9, and now accruing 104 active cases related to the Avalon outbreak, is it time to expedite the approval of our vaccines? No, according to the Federal Health Minister today.
One of the things that's very important for the take-up of the vaccine is that the public doesn't want to see corners cut. They want to see that we are thoroughly assessing, and that's what we're doing, but we're doing it at a record speed, but in an utterly comprehensive way. We're likely to get a higher take-up of the vaccine than in many other countries because we are a great vaccination nation, but we are because people have complete confidence in the world-class leadership and quality of our medical regulator.
Back on the 60,000 tests in New South Wales, though, I couldn't help but compare brilliant to woeful today as the Northern Territory Cabinet made the inexplicable decision to change protocols as a Jetstar flight from Sydney was about to land in Darwin. Now, these people did the right thing, these passengers, by not visiting the Northern Beaches and were told they could return to their homes in Darwin and isolate. That was on takeoff. By the time they landed, new rules had come into play, and rules are rules. In the NT, no discretion, even at Christmas time. So when passengers arrived, they were ferried straight to Howard Springs detention camp for 2 weeks of compulsory quarantine. Their Christmas was over, and they were far from happy.
This was just plain cruel. And cruelty has no place in public politics, in public policy, if it can be avoided.
But late today, the NT Acting Chief Minister announced that the government had reversed its silly decision and had lifted the ban on residents who come from Greater Sydney.
We can revoke the large majority of the local government areas that are currently declared hotspots by the Northern Territory.
A voice of reason at last. They finally got it right eventually. The level of official competence in this country this year has varied significantly, but let's not trawl through the damage again. Meanwhile, it's a given that Christmas celebrations inside the home will create a perfect storm for the spreading of any existing virus in any jurisdiction, which is why the New South Wales Premier had this advice.
Reduce your mobility, limit your activity to those close family gatherings, don't do anything you don't need to do. And please, of course, if you are in contact with people, make sure you're socially distancing. If you're in an indoor setting, please make sure you're wearing a mask and make sure you're using hand sanitizer at all times. So we need everybody to be extra COVID safe over the next few days.
And this is something worth considering for tomorrow. The New South Wales Chief Health Officer wants us all to move our dining rooms outdoors.
If we can really limit our mobility at this time, if we can keep our gatherings small, and if we can also choose and preference outdoor settings. So if you're hosting a Christmas dinner for your small group of family, please see if you've got a veranda or an outdoor area where people can congregate. We know that those areas are much safer than indoor environments. But can I stress it? Can I please stress this point, that if we have asked you to isolate, you need to be in isolation. I apologise to everyone who has been put in that predicament, but it is incredibly risky.
Good advice, good advice. But the most priceless medical advice of this entire pandemic came from Gladys Berejiklian, of course, as she delivered a message for all those waiting silently for Santa's arrival tonight.
Our authorities have been in direct contact with Santa Claus and his people, and we've told them he has free rein throughout New South Wales, so nobody needs to worry. But we are providing a recommendation that children leave some hand sanitizer for him. He has plenty of masks, but he is running out of hand sanitizer.
Yeah, forget the beer, hand sanitizer is the best. Free rein, I like that one. Jolly good advice. And if you don't hear a ho, ho, ho late tonight, it might be because Santa has his own ruby red face mask on.